Hello everyone. In this video, I will be sharing a novel two-drug combination therapy approval for the treatment of complicated urinary tract infections. On May 29, 2026, the US FDA approved a intravenous antibacterial combination therapy, ZAYNICH, Cefepime, and Zidebactam, for the treatment for adult patients with complicated urinary tract infections, cUTI, including Pyelonephritis, caused by designated susceptible microorganism. Notably, in February 2024, Zidebactam, another Cefepime combination therapy with Enterobacterales, was also approved for the same indication. This new antibacterial approval adds another significant treatment option to address evolving antimicrobial drug resistance. Now, let's dive into this medication in more detail. Cefepime and Zidebactam, brand name ZAYNICH. This combination medication therapy was approved by the US FDA on May 29, 2026. And indicated for the treatment for adult patients with complicated urinary tract infections, cUTI, including Pyelonephritis, caused by designated susceptible gram-negative microorganisms such as E. coli, Klebsiella pneumoniae, Proteus mirabilis, Enterobacterales complex, and Pseudomonas aeruginosa. This new antibacterial therapy will be largely used in the hospital intensive care units (RCU) setting. Chemically, Cefepime is a fourth-generation cephalosporin antibacterial agent, which is shown in red. Molecule weight 480.56 gram per mole. Hydrogen bond acceptor 11. Hydrogen bond acceptor refers to the number of nitrogen and oxygen within the drug molecule. Hydrogen bond donor 4. Hydrogen bond donor refers to the number of OH and NH groups within the drug molecule. Log P negative 1.62, which is a lipophilicity parameter. The higher log P, the more lipophilic a drug molecule. Polar surface area 204 square angstrom. In addition, Cefepime is present as the monohydrochloride and monohydrate. In contrast, Zidebactam is a beta-lactamase inhibitor and a non-beta-lactam antibacterial agent, which is shown in blue. Molecule weight 391.4 gram per mole. Hydrogen bond acceptor 12. Hydrogen bond donor 4. Log P negative 3.01. Polar surface area 166 square angstrom. Zidebactam is present as a dihydrate form. As you can see, both agents have a negative log P and pretty hydrophilic as they are mainly excreted renally and used for the treatment of complicated urinary tract infections. ZAYNICH 3 grams. Cefepime and Zidebactam for injection is supplied as a sterile powder for reconstitution in single-dose vials, containing 2 grams Cefepime and 1 gram Zidebactam. Recommended dosage: ZAYNICH 3 grams. 2 grams Cefepime and 1 gram Zidebactam every 8 hours by intravenous infusion over 1 hour for 7 to 10 days in adult patients with an estimated glomerular filtration rate (eGFR) greater than or equal to 60 milliliter per minute. For patients with impaired renal function with eGFR less than 60, dosage adjustment is recommended. Specifically, the ZAYNICH dose will be decreased to 1.5 grams with the dosing interval of every 8, 12, or 24 hours, depending on the eGFR value. See prescribing information for details. Mechanistically, this two-drug combination of antibacterial therapy contains cefepime, a fourth-generation cephalosporin antibacterial drug, and Zidebactam, a beta-lactamase inhibitor, and non-beta-lactam antibacterial agents. Cefepime primarily inhibits penicillin binding protein 3, PBP3, in gram-negative bacterial pathogens, while Zidebactam selectively inhibits PBP2. By blocking the PBP enzymes, this inhibits the biosynthesis of peptidoglycan in the bacterial cell wall. Ultimately, cefepime and Zidebactam work together to bind multiple PBPs with bacterial killing effect. Also, notably, the Zidebactam component of ZAYNICH exhibits in vitro activity against various types of beta-lactamase. Pharmacokinetically, protein binding of cefepime is 20%, and protein binding of Zidebactam is 4.0 to 5.4%. The volume of distribution of cefepime and Zidebactam at steady state in healthy subjects is 13.7 and 15.5 liters respectively. With regard to half-life, as you can see, both agents have a short half-life, 1.8 hours for cefepime and 1.7 hours for Zidebactam. Metabolism, both agents are minimally metabolized. Excretion, both agents primarily go through renal excretion as unchanged drug molecules. In the urine, 85% as the parent drug molecule for cefepime and 88% as the parent drug molecule for Zidebactam. Drug-drug interactions. For patients who are also on aminoglycoside antibiotics, monitor renal function for concomitant use with ZAYNICH due to the increased risk potential of nephrotoxicity and ototoxicity of aminoglycoside antibacterial agents. For patients who are also on diuretics, monitor renal function for nephrotoxicity when ZAYNICH is concomitantly used with potent diuretics such as furosemide. With regard to drug laboratory test interactions, ZAYNICH may lead to a false positive reaction for glucose in the urine with certain methods. Contraindications. ZAYNICH is contraindicated in patients with a known history of serious hypersensitivity to the components of ZAYNICH, cefepime and Zidebactam, or other beta-lactam antibacterial drugs. The most common adverse reactions greater than or equal to 2% associated with ZAYNICH include diarrhea, headache, hypertension, and hypokalemia, which is a decreased level of potassium level in the plasma. Here are the key sources which I have used to prepare for today's video. The US FDA New Drug Approval Updates for 2026 is a very valuable resource. In addition, most of the medication information which I shared today is based on ZAYNICH prescribing information. This document is available at the US FDA drug website, along with the drug manufacturer website. Finally, I want to thank you all so much for watching. If you found this video helpful, subscribe for future medication video updates. As always, keep learning and elevating. Thank you so much.